of Second Opinions. He's the CEO. And I have to just tell you, he has helped so many people, and we're so pleased to have him work with us, because when he does good things, it makes me very happy. So thank you for being here, Dr. Hughes.
Thank you so much. Always a pleasure being here.
Yes, and Second Opinions has just moved from, I keep thinking that you've been around for so long, and you really haven't. You've just gone like a spaceship, woo, right up.
Yeah, we are. Well, actually, we are a 6-year-old company. We started in 2008, but the Second Opinion division does take us to the moon quickly.
It does. So. You have gone to the moon. So why don't you just maybe give a very fast explanation for maybe some people who haven't listened to you before. What is secondopinions.com?
Sure. Secondopinions.com is the consumer portal where we connect the doctors, top American board-certified doctors in every specialty, to patients around the world. So when patients need a second opinion for any number of reasons, they come to us and we give them the answers. We connect them with a top doctor, typically same day, typically within several hours, and they can speak to a doctor, they can do video conference, or they can obtain a written report from a doctor.
And you know, Dr. Hughes, I have to just say that Second Opinions is so critical. It's life-saving. And so many people have never even thought of having a second opinion for something that's happening to them. And it seems now that I've been with you for the past year that how can anyone do anything that's serious without having a second opinion?
Well, you're right. When patients find us, they form emotional attachment to the service. So once they use it once, and then they use it every time, and then they tell their friends and family. So this is how we grow.
And one thing you told me in the last time that we talked, which I thought was just incredible, is once someone works with you, you keep their records all the time, and that's very unusual.
Well, we store. If the customer or patient decides to upload all the records, like a personal health record, then we keep it. We store it without any kind of any additional cost or anything like that. So it's up to a patient to upload as many records or the records they choose to us. Now, we went beyond medical records. We went and then integrated a very, very critical service, which is called image upload, archive, and sharing service. So if you had any kind of imaging, you can now upload all of your images. You could store them for at least 7 years. You could retrieve them anytime. You can view them anytime, and you could share with any of your doctors. Think about how important this could be when you have a lot of imaging done, or you go from hospital to clinic and you move around. You know, that's very important.
Oh, absolutely. So it's an archive, and sure, because you could wind up in New York. Let's just say you had your treatment here. You wind up in New York, and the first thing you want to know, well, what's happened and what does it look like? Then you have to say, well, I have to go find my records. They used to have to mail them. Remember all that?
Yes. Those days are gone with us. I mean, it's still an issue. I mean, I can tell you as a radiologist, and I love radiology. I practice every day. I read still a lot of films and MRIs. So it's a major problem to obtain an old study to compare. Now, with a service like ours, this becomes less of a challenge. I mean, this is very, very important in medicine.
It is so important. I remember I had my mammographies at a place for 20 years, and I went to a different place to do it, and they had to get all their, all the back, all those prints, all the X-rays, and so then they said, well, can you come pick them up and then bring them over there? I mean, that's the thing of the past. That was like caveman.
Correct. This is not only this is very convenient now. We can store all your images in one place, but also it reduces hazards such as X-ray radiation. People forget that radiology carries a lot of risks. Every time you get a CAT scan or X-ray, you increase the chance of cancer. So people don't think of that, but
no, we don't think of that.
People have to do a lot of redundant imaging, and this we could eliminate. Actually, not to mention that the diagnosis would be much faster or streamlined when you have all your records at once. So a lot of things are missed. Medical mistakes do happen because of lack of prior records. So.
Oh, that's a very good statement. We're going to repeat that. Many medical mistakes do occur because of lack of medical records.
Yeah,
yes. Absolutely a beautiful statement. That should be your new logo because it is true. Okay, so tell us, you've been working very hard now. You have wonderful new, you have a new, I guess he's what is COO?
We brought on board Lorna and Brent Bakehouse, who are the pioneers in telemedicine. And Lorna is the Chief Business Development Officer, and Brent is the President and Chief Operating Officer.
Yes, and it's a very important thing that now as you grow, because you're doing so many things, that's what I've loved about you and your company. You didn't just say, okay, we're going to do second opinions, and that's where we are. You have moved forward so fast because that's how your mind goes, Of course, you're an inventor, really. But being a radiologist yourself, you stuck to something that you knew, and you knew all the problems in this field because it's not like you were a foot doctor and you decided now that you were going to do this. You've been in this field of radiology, and you thought of all the things that should have happened and didn't happen, right? That's why you started this.
I thought I'll be doing this actually when I was a teenager. So everything I've done was towards, this evolving area, which I thought of many years ago, including even buying the domain name, domain names that would help me.
Of course, secondopinions.com is a very important domain name. It's so easy to know. All right, so let's say this week has passed and you have so many calls, you have so many people are coming to you. What would we like to hear about that will be not only entertaining but very important?
Well, I could tell you a couple of days ago we had a little sad case, second opinion case, but also very important. We had a case of two parents from California who uploaded a CAT scan and X-rays of the little baby who was not moving, who was apparently something happened to the baby. So when we saw the images on the CAT scan, the little baby, 4-week-old baby, had a skull fracture and intracranial bleed, so some bleeding inside the brain. We gave a very professional second opinion, and I described the findings. And then we determined that when the injury happened, because they needed to know when it happened, and then we determined what could have caused the injury. So apparently, the baby was under care of some babysitter that they didn't trust. So we helped resolve a very, very, very important causation of what could have happened to the baby. So that's something that very, very critical for the parents to know and improve.
Oh my heavens! And so did the baby die?
No, the baby didn't die. Actually, the baby's going to be fine. Baby's going to be fine. So, but the injuries were severe.
So, oh my heavens! And most people probably wouldn't have known. They wouldn't have done something like that. They would have just lived with what happened. But they were smart enough to have said, "We want to take this to a real expert and let's see what." Now, how did you figure that out? It's because of what showed on the screen?
Actually, in MRI, you can tell how the age of the blood. The blood ages and it changes what we call signal on MRI. So it's almost like forensic imaging. So and we could see based on the type of skull fracture and where the blood was, we could tell if this was the direct impact or did the baby fell, for example. So you could tell. Also, if you see multiple injuries, you know most likely baby didn't fall, but most likely it was inflicted, by external force.
This is a tiny baby you're talking about too. Mm-hmm. Oh, this was heartbreaking because you have your wonderful children, and so it's hard to separate sometimes being a physician, being what you are, and then what really happened. Well, that was a wonderful thing that happened here.
Yeah. Now, also important to mention, and we sometimes talk about it, is that sometimes our customers, patients, obtain second opinion before the first opinion. So the speed at which we're able to do it, like in this case, we gave our opinion within hours. But then they obtained later, I don't know what the primary report stated, but certainly it was very important, our opinion.
Well, I can attest to that because I have used the service of second opinions on a few occasions, and right away usually the doctors say, well, we'll let you know in 3 days. That's typical, right? But when you know about secondopinions.com, you just say to yourself, no way, I'm going to get secondopinions.com and I'm going to know about this at least in a day, not wait.
Right, absolutely.
So, time really is the essence in your business. You know that. I mean, with medical, as you said, with medical care, whether it's cancer or something else, people want to know right away. And up until you had this company, it was like hitting your head against a stone wall. I mean, the doctor just said, well, we can't do it, or for some reason the lab couldn't do it, or what are those reasons? I mean, is it just because they don't understand? I mean, why can you do it and why can they not do it?
Well, we have the factory. We there's a lot of moving parts. So it's like a fine, clockwork. We're able to put together all the processes in the proper fashion. Where it takes everyone else days or even weeks. I mean, we didn't invent second opinions. I mean, second opinions existed since the medicine existed. But even before us, even other services who are offering this type of service, it still takes them weeks and weeks, and it's very expensive. So what we've reinvented the wheel is in a way that we've made it much more efficient and at your fingertips via internet, and that's what we've done.
So for those of you, I really want, I always beg people, since you've been listening to us for so long, remember, this is Pencil Talk Radio. Get your pencils out. This isn't something you may need today, but you may want it tomorrow or the next day. You really ought to have the phone number and how to get them. Now, if you are on the internet, it's so easy. It's just the word secondopinions.com. If you're not on the web, let me give you a phone number. It's 855-573-2663. Again, it's 855-573-2663. And of course, the website again, so easy, secondopinions.com. They are actually now located their headquarters are in Broward County, and they are worldwide. So you're not just going to deal with that second opinion isn't just coming from one man sitting at a desk. You ought to really understand what your network's like.
We have over 1,000 physicians in every specialty, all board-certified American physicians, handpicked by myself and the committee who selects them. We're a joint commission accredited company, so we have a very systematic approach in how we do business, how we select physicians, and we've been in business since 2008. So that's one of the reasons why we are able to put together such an efficient process. We've done it, for so long, and we're experts in telemedicine.
Now, the doctors who you are dealing with, you had once said that at first this was second opinions and it's just a radiologist or somebody who can analyze the x-rays. But you've gone further. Now you said that if someone needs an opinion about a particular case, whether it's cancer or some heart disease, you also now will help them find those people.
Yes, we have physicians in every single specialty, and we're able to help patients not just in the United States but also around the world. So absolutely, and we've actually gone beyond consumer products. We've partnered with actually a local company called Solstice Benefits recently, and what they are the healthcare exchange with several thousand healthcare brokers in their network. So now the brokers, in addition to the corporations already in the network, they're able to offer our service as a corporate program. That way, we are not only we have individual patients come to us, but we actually have corporations that are our clients. So this is sort of the way to have a lot of people know about us much quicker.
Well, this is like the benefit program. When you join a company, you get sometimes they pay for your moving,
Correct.
They pay for your insurance, and now you have convinced them that they also pay for second opinions.
Yes,
which I think is a great idea.
It's actually very economical. It's only for a corporation. It's a few bucks per month per employee or per family member. It's really, really economical to have this type of service. So most employers do pay for this service and give this service free of charge to the employees.
So let's go into some individual cases. So let's say somebody has scoliosis and they're going to have maybe an operation. Would they then want to contact your company and tell you what they're going to have done, and then you would analyze this? I mean, I guess they would send in their X-rays, and then what happens?
Well, are you talking about individual patients?
Yeah, an individual patient.
Sure. So,
well, because even the ones that are these are individual patients now.
Whether they come to us directly or through the corporations.
Association, right?
Of course. So in this case, let's say the spine surgeon recommends a surgery or some kind of corrective device, which is very expensive, obviously. So both the patients and their insurance companies want to know, do they really need this surgery? So you can understand why insurance companies are on our side. We are really lowering the cost of medicine. So the patient that you describe uploads the X-rays or MRIs or medical records, and we provide a second opinion report. And then we state, radiologist sometimes states if the surgery is indicated or not. If it's a complex case, then we also involve one of our spine surgeons, for example, who can also give their second opinion. So that at the end of this exercise, the patient's doctor will get a recommendation, and the patient themselves, if the surgery is really indicated. So if let's say we do this on 10 patients, and if we are able to eliminate only one surgery, you can imagine the costs, the cost savings for everyone in the chain, for the insurance company, for the corporation, because they don't have to lose that patient to weeks of surgery and rehab and that kind of stuff. And to the whole healthcare system. So we're really providing important service.
Yeah. So you're like when there's a court case and they bring in an expert witness. Is that what really is happening here?
We have introduced the second engine in the healthcare system, which running on a single engine. Sort of an airplane analogy.
Right. So. No, because I think we can understand that. So, for example, if someone is having a problem, they're going to go in for an operation, it probably would behoove them to send things to you and say, this is what's been diagnosed and what the prognosis is. What do you think? Right? That's pretty much what we're talking about.
Absolutely. So we're basically providing another opinion, which is much likely it will be more conservative than the first opinion. Why? Not all. Obviously, most doctors are very honest and they practice with high standards. But there are doctors who are, for some reason, they either undertrained, they don't follow the new guidelines, they don't know the new. The new research that's coming out. They
can make mistakes, as you said for the beginning of the show.
Doctors make mistakes, and some doctors, unfortunately, do it on purpose, either to make themselves rich, or because they're dishonest and like that oncologist in Michigan.
Yes, you told me about right.
Diagnosed patients with cancer which they didn't have. So
I know. I mean,
so that happens.
it's a wonderful check and balance for you. And you know something, that if you've gone for a second opinion already for something and it still doesn't feel right, why don't you call thesecondopinions.com? He's used to third opinions. He said that some serious ailments require third opinions. Different. It's really opinions. Let's remember that word. You have sought out excellent doctors all over the world. So their opinions, something that somebody can't just get into a phone booth. I don't have phone booths anymore. They can't just go to Google, find somebody that specializes in something, and hope that was the right person. Through what you do, you analyze what the situation is, and then you decide who you think is the best person in your list.
Absolutely. Every case that we get, we have a panel that decides who this case goes to.
Oh, you do?
Well, we have, it's an automated process, but then we have a list of doctors, and then we have a medical we have a physician. It could be even myself who makes the decision, and also the for example, some medical a nurse or somebody or physician assistant who understands and sometimes matches. Although a lot of it is done in automated fashion. Now, what's also important to mention that if the patient does need a treatment, we also help the patient find the best doctor to see or the best hospital to see. So we have some famous hospitals in the network that we recommend, and some specific doctors that we recommend. Now, so it's not only online or phone second opinion. We also actually help with management.
And will you follow up on all that and follow through? So let's say you recommend someone and you did this. Do you then go back and try to make sure everything's going well, or is that a little bit more than you?
We try, yeah. We try some serious cases. We would like to know what the outcome. I could tell you an interesting case. We had last week. We had somebody from Dubai. It was actually a member of a royal family in the United Emirates, and from Dubai. That it was actually a young gentleman in 20s who started having this intractable headaches for weeks, and so they uploaded their MRI, and surely enough, one of our neuroradiologists read it as an aneurysm, very large, like 2 centimeter aneurysm in the brain. Now, so then the second question they ask, can you recommend us the best hospital where we can send the patient? And we made a recommendation. One of the hospitals in the United States, Arizona,
because they can afford anything, but they needed to know.
They needed right. So we made a recommendation. Now, unfortunately, they waited a little too long. So they should have brought the patient immediately, and instead the patient had a stroke. So had a stroke, young patient, very sad. I think the patient should be okay at the very end because it was a small area of stroke, and they finally actually flew the patient to the hospital, and he had an operation. So that just happened a few days ago. So I'm going to follow up.
That's a perfect example of what we've been talking about. You were fortunate enough to find it, and if they could have sped him somewhere to have it taken care of.
At the best possible hospital. So
that's a great story.
So this is the one. That happens, and that repeats.
It does.
That type of story repeats itself.
So now. What about? We talked about this before. I think you brought someone on with hip. They had to have a hip operation. They were going to, but they didn't because it wasn't really necessary. Do you get, of all the kinds of second opinions, do you get it on a lot on the on knees and hips? Is that very common to see if they really need it, or who should they go to?
It's a fairly common. I think the most common request is actually the back surgery or anything related to spine or brain, and then the second common is the joints. The joint request, like you said, knee or shoulder. So that's absolutely. The musculoskeletal issues are very common, and the spine, brain, very, very common requests.
Well, I want to give everyone your website again. Remember, it's so easy. It's second. You have to write that word out. Secondopinions.com. Secondopinions.com. And the phone number is 855-573-2663. That's 855-573-2663. Well, I have to tell you, yesterday Dr. Mencia had his open house at his new Boynton Beach Center. And a lot of people from the radio show were there. They're saying, oh, I listened to you on the radio show. And I did have someone that came up to me and said, I need to talk to that. Don't you have something in there about second opinions? And I said, yes, we do. And it's great because people really do care. They really do know. See how, if they didn't have the show, how are they going to know a lot of this stuff or have it in the magazine? That's why you do a great service, and we really appreciate everything you do,
Thanks so much. I just want
Dr. Hughes.
Thanks so much. I just want to mention also that we've had a Fox and Bloomberg. We're going to be at Fox and Bloomberg next month.
You'll let us know when, so we can announce it on the radio. So congratulations.
Thank you. Which will give us actually global exposure.
Several
100 million households.
Amazing. We're so pleased that you've started with us right here. Thank you very much for being with us, and we'll see you here next week. Thanks for joining us.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
ABC News, I'm Daniela Bellotta. New Jersey does